Dr. Toor from Amplify Eye Care here in Olympia, Washington. And today we're going to go over a couple things that you can do to prevent a disease called macular degeneration. And so macular degeneration is typically something that affects more of the older generation, but there's some steps you can take beforehand that can try to prevent it. But just to kind of go over what macular degeneration is, it's a disease of the retinal tissue in the back of the eye, and pretty much age, sun damage, poor nutrition, things like that can cause these waste deposits to build up in your central vision. And now luckily with these waste deposits, the effect on most people's vision is pretty minimal, but then there's certain types of macular degeneration called wet AMD that can cause more severe vision loss of your central vision. So in order to prevent these, of course, there's some things that we can't control, like age or a family history of it. And then on the other hand, there are certain things that are within our control. So one of the probably biggest risk factors linked to AMD is smoking. Smoking can actually increase your chance of developing or it progressing by, I believe, 3 times. So either not picking up smoking or trying to stop the best you can is going to benefit your eye health overall very much. The other thing is in your diet, eating green leafy vegetables. A lot of those have the nutrients that we need to support our retinal health and keep it all healthy. And then wearing your sun protection as long as you can, or whenever you're outside, to block out as many UV rays as you can will also prevent the progression of AMD or prevent the onset as much as it can. So those are 3 of the easiest things to implement in our lifestyle. Of course, the other things that you can do if you're a little bit higher at risk is getting your yearly eye exams done so the eye doctor can take a look every single year to make sure that there's nothing to be concerned about. There is usually a grid that you can use to monitor your vision as well, and it kind of just looks like a checkered grid. I have one here. So you cover one eye, look at the central dot, and make sure that there's no kind of missing or wavy lines, and you do that with each eye. This is an example of what it could look like if you have macular degeneration, where those lines are just kind of distorted. So typically these are given to patients that already do have macular degeneration or are being watched closely for it, and it's a quick, easy way to monitor if your vision is changing at all.